Hi, welcome to the first What's Happening in Brazil of 2021. We have prepared a special program to remember some of the important events of 2020. Stick around! Brazil was one of the countries most affected by COVID-19. It is second globally in total number of deaths, behind only the United States. Amid this tragic situation, the Brazilian government seems to have done everything to make the situation worse. On several occasions, President Jair Bolsonaro ignored the pandemic, bringing together supporters without using a mask, and even said that he wouldn't take the vaccine. Check out our year in review.
The novel coronavirus arrived to Brazil more than 1 month after it had spread in Asia and Europe. The first confirmed case in the country was on February 26th, and the first death was on March 12th. This window of time could have served as an advantage for the country to prepare for the new disease, but that did not happen. COVID-19 took Brazil by surprise, with a president that from the very beginning minimized the seriousness of the pandemic.
No meu caso particular, pelo meu histórico de atleta, caso fosse contaminado pelo vírus, não precisaria me preocupar. Nada sentiria ou seria, quando muito, acometido de uma gripezinha ou resfriadinho.
It was not just in speeches that Jair Bolsonaro ignored what the public health authorities said, but also in his actions. From March 7th to 10th, he was in the United States accompanied by a sizable entourage. More than 20 of the group returned having been infected by the virus. Due to the risk of infection, Bolsonaro was instructed by the Ministry of Health to avoid contact with the public, but he did not respect the recommendation. On March 15th, he appeared in a street mobilization against Congress and the Supreme Court. During the second week of March, states and municipalities began to adopt measures to restrict circulation, like closing non-essential businesses. Bolsonaro manifested against these measures, saying that the economy could not stop.
Como as vidas não valem nada,
as if these lives were worthless, that these poor people died, these people that are part of an army, surplus, cheap workforce. Because if they died, there are still many left. It is this logic, a logic of almost social Darwinism. Save yourself if you can. The rich are protected. They can take a jet and seek treatment in an expensive hospital. This logic is very perverse.
Então é muito perverso essa lógica.
The president's positions created friction within the government. On April 16th, the then Minister of Health, Henrique Mandetta, resigned. His successor, Nelson Teich, stayed for less than a month in the position. He also stepped down after diverging from Bolsonaro with regards to social isolation and the use of hydroxychloroquine in the treatment of COVID. The drug does not have proved effectiveness against the disease, but the president defended the use of it on several occasions. When he himself had COVID in July, he recorded videos taking the medicine. Even while infected, he appeared before his supporters holding a box of the drug. The milestone of 100,000 dead from COVID-19 was reached on August 8th. The low-income population was the most affected.
A great deal of the population in poorer areas is on the front lines of essential services. They are the trash collectors, the ones driving buses, the cashiers at stores, pharmacies, the ones keeping the city functioning. Besides this, a large part of those residing in impoverished areas work in informal settings. Another part is unemployed. People need income daily, and they have been left behind by public entities.
The challenge that Brazil faces now is related to the vaccine. The health ministry has yet to define a timeline for the immunization of the population, and says that this timeline will only be finalized after the vaccines are approved by Anvisa, the body that regulates the use of medicine and vaccines in the country. In recent interviews, Bolsonaro has said that immunization should not be mandatory. In a live transmitted on Facebook, he even said that he will not be vaccinated. The president had also stated that the pandemic is reaching its end, despite the numbers showing the opposite. Since the end of November, Brazil has been undergoing a second wave of COVID-19, with an increase in number of cases and deaths.
Em primeiro lugar, não tem país do
There is no country in the world, at least not as big and important as Brazil, whose president is a more dangerous enemy than COVID-19 itself. All of the other countries have sought to build unity, have sought to bring together the political and governmental forces, involve society, to adequately inform, and call on everyone to work in the same direction.
todo mundo para remar no mesmo sentido.
It was a difficult year, but it also had its positive sides. Solidarity was a central aspect of 2020 in Brazil. Many non-government organizations and social movements joined together to provide food to those who lost their income during the pandemic.
In the peripheral areas, the COVID-19 pandemic revealed a disease that has plagued Brazil for a long time: social inequality.
The question of famine is exposed in a very cruel way, because it is as if the famine was hidden with walls and suddenly surfaced a lot. So it is very grave.
Organizations that already worked in these areas began to give support to the most vulnerable families.
First of all, we don't want to die of hunger, not of COVID. So our major concern has been this emergency. A lot of people like me have been laid off and have not been working. So since the pandemic, we have been gathering to promote all kinds of actions, collecting food, hygiene kits, covers, clothes, and organizing the distribution of basic food baskets.
The unity between the countryside and the cities was fundamental in this time. The Landless Rural Workers Movement (MST) was responsible for the donation of 3,800 tons of healthy food and 700,000 meals since the arrival of COVID-19. In Recife, the capital of Pernambuco, the movement distributed meals for people in a situation of homelessness.
Our main is with the homeless population. So according to WHO guidelines, we put people in line 2 meters apart from each other, and also have volunteers and fences to keep the lines organized and make sure our workers are not as exposed during the process. All our volunteers wear personal protective gear such as masks, gloves, and we have plenty of hand sanitizer, and all our spaces are sterilized twice a day.
In Paraná, in the southern region of Brazil, food produced in settlements and encampments were sent to the tables of the most needy in the urban centers.
When you have the capacity to donate something for someone who needs it, is a pleasure only God can express. It is a great satisfaction for us to be able to help out and donate something.
The acts of solidarity increased around the time of Christmas. One of the biggest and most historic initiatives is the campaign Christmas Without Hunger. Since 1993, the campaign has helped more than 20 million Brazilians during the time of Christmas. However, one of the leaders of the project highlights that solidarity cannot replace public policies, like the emergency aid. This financial aid was given to the most vulnerable families during the pandemic, but it will not continue into the next year.
The problem of hunger, the problem of misery, is not a question of millions of reals, it is a question of billions of reals, and only the government has the capacity to resolve these full public policies. Even though civil society has made a huge effort and achieved a lot this year, it does not compare to what emergency aid does with regards to the economy. This was the greatest reduction of inequality in the recent history of Brazil.
To close out this year in review, here are some of the images that stood out in 2020. Happy New Year to all!